Hi, are you looking for a how to self-massage your pain away video? Then this video is for you. I'm Dr. Karin Drummond, owner of Drummond Chiropractic. And before you follow any advice from any video, check with your healthcare provider to make sure it's appropriate for your specific condition, because you don't want to be massaging, for example, leg pain when it's caused by deep vein thrombosis, because that can make it emboli and that can be fatal. There's a reason why massage therapists go to school. It's not just to learn how to massage, but when to not massage. So before I share with you how to self-massage your pain away, I'm going to share with you a little bit of anatomy. It won't take very long because the better you understand your body, the better you can take care of it. So what makes tissue tender? When a muscle contracts, it produces lactic acid. And so when there's a buildup of lactic acid, then your muscle's going to be tender because it's full of acid. So how can a muscle build up with lactic acid? So this is where I'm going to go into the anatomy. Most people know that there's a heart that pumps nutrients to the muscles. The nutrients get to the cells of the muscles by the fluid. And then the muscles, when they contract, they use the nutrients to contract and they make metabolic waste like the lactic acid. And then that acid gets put into the fluid again, and most of that fluid makes it back to the veins where it gets filtered out by kidneys and the liver. Now, not all the fluid makes it back into the blood this way. There's another system called the lymphatic system, and this system is made of vessels that have one-way valves, and the lymphatic system doesn't have a heart. Instead, it relies on the vessels to do a peristaltic activity to milk the fluid all the way back up to the ducts where it dumps back into the veins. These vessels have one-way valves, so when you're sitting there or standing there, gravity doesn't backwash it down the body. It also relies on muscles to contract and relax. And when the muscles contract, it squeezes the fluid up the vessels. So if you're just sitting still, can you see how that can impair the flow of lymphatic fluid? Or if you have a knot in the muscle where it's chronically contracting, making more metabolic waste, it needs more blood flow in and blood flow out to bring nutrients in and waste out. And instead it's sitting there contracting, impairing blood flow and lymphatic flow. Can you see how that can lead to a buildup of metabolic waste? And then that will lead to a very tender muscle because it has too much lactic acid around it. How do we milk this tenderizing metabolic waste out of the body? By using strokes that help the flow. So if you're just thinking of the muscles, you might just rub up and down because you're not thinking about how to help the metabolic waste drain out of the muscles. With this technique, you're going to help the muscles relax and you're going to help the lymph flow. You can use tools that you should have already in your house, like a rolling pin, or you could just use your hands. I'm going to start with the feet. So for the feet, you want to start distal, which would be the tip of your toes, and you can milk the metabolic waste up the toe and up the foot. You can do each individual toe, and then you can act like your foot's a rag that you're literally wringing out the metabolic waste. And this also helps mobilize the joints in the feet. And then you can do a heel squeeze to help pump out the metabolic waste. Then you can go up the leg. Notice how I'm doing a wringing type action with my hands. Use a pressure where you're feeling it massaging. Use a pressure that you can feel a good pain, but not a bad pain. And what I mean by that is you can usually tell that, oh, that's a good pressure. It's doing some therapy, but it's not so much pressure that it's causing a bruising type sensation. You might even find a knot in your muscle, and if you do, you can hold on to that muscle and breathe for 3 breaths. And as you feel it release and getting less tender, then you can let go. And again, use a pressure that feels like it's doing something, but not bruising you. Bruising is not conducive to healing. You could also use a rolling pin. And again, starting distal, you put some pressure and you roll up the tissue. Take the rolling pin off and roll up the tissue. You have lymph nodes in the inside of your knee. You might find some tender spots there. If you do, don't rub it. You don't want to irritate the lymph node. Just press and release. And then again, you can go up the thigh with the rolling pin. And then to do the outside of the leg, you got to watch the health of your knee. If that's too hard on your knee, you can have your knee up. And you have a bone on your shin, you don't want to be rubbing on your bone. Go off to the side of the bone. Make sure you're on the meat of the lower leg. You do the outside of the thigh, inside of the thigh. And then you have lymph nodes in the groin area that you just press release. Now I find this is easier to work if you're laying down. For the hand, just like the toes, you just milk the metabolic waste from the fingertips up. You do all 5 digits. And the palm, you just stroke up the palm, up the forearm. You have 2 bones in your forearm. You want to go between them and milk the metabolic waste up. And then up your arm. And for the armpit, there's lots of lymph nodes in there. So you just take your pec muscle and give it a good squeeze with your arm relaxed. And there's lymph in your breast tissue, whether you're male or female, you do have lymph in the breast tissue, and it's really important to keep that area metabolic waste free. Now with breast tissue, and for your upper pec area, you want to press from the center of your sternum all the way out to the shoulders. For the face drains in. So I have a video that shows how to do cranial release and pressure point therapy, which I'll put on the link below. And then for the neck, you want to make sure you work your way from the jawline down the anterior part of your neck. You don't want to do both sides of the neck at the same time because you have carotid arteries that have sensors that detect pressure, and that can affect your blood pressure. Another thing you can do is to help drain your head, which can help with headaches, is you stroke down your skull. I like to put pressure on the top of my head and stroke down with my thumb because that helps also get the cranial bones moving. And for the back, it doesn't matter if you're stroking up or down because the metabolic waste goes from the outside in. So just putting pressure on the back is going to help drain the metabolic waste. I like to use a foam roller to help massage the back. You don't want to do the low back when it comes to a foam roller because you don't want to hyperextend the back. So I like to go where the middle of the back ends, where the curve goes from the lordotic curve to the kyphotic curve, supporting your head and then arching back. That'll help stretch the spine. And then you roll down a little bit to stretch the spine a little higher, and then you roll down a little bit more to get a good release for that upper back. This is good for those that sit at the computer too much or slouch. And then to massage the lymph, you just raise the buttocks up and go up and down your spine just like that. And another way to drain the lymph from your extremities is putting your feet up in the air and drawing the alphabet. That way you don't have to worry about remembering inversion, eversion. You just think about A, B, C and go all the way to Z. You do each leg, and that'll help not just drain the lymph, but stretch your hamstrings. And then for your hands, same thing, putting your hands up in the air and just moving them around, opening and closing your wrists. And that's a good way to pump the lymph out of the extremities. Now with breast tissue, it doesn't have muscles surrounding it because most of the body, there's muscles when you contract, it wrings out the lymph as well and really propels it through. Breast tissue does not have this. And on top of that, if we wear a bra, can you see how that can occlude the lymphatic drainage up and out? So, and especially if a bra is poorly fitted for you, it will even occlude the venous return, and your veins can engorge with blood. It's kind of like having a varicose vein, but in your breast tissue, which is terribly painful and can discolor the breast. So what you want to do for that is make sure your bra is fitting you well, make sure you wear it as little as possible, and at the end of the day, check and see if your breasts are tender. If they're tender to touch, that is not a sign of healthy tissue, right? So if it's tender, you just have to milk that metabolic waste out. And usually when you do a lymphatic drainage technique, you just got to work towards the heart. But with the breast, it's like a wheel with spokes, and you want to follow the spokes of the wheel. So you would start at the nipple, and yeah, you would go towards the heart here, towards the sternum. But below the nipple, you want to stroke down away from the nipple. And then on the side, you want to go from the nipple to the armpit. And there's lymph nodes that can be filled with metabolic waste too. And if there's some tender spots, go ahead and milk those out. I like using the press and release technique because that's really good at squishing things out without tenderizing it. Because it's not like a muscle that you want to rub a sore spot out. You really want to milk it out. And then once you get around the breast all the way around once, if it's still tender, you could do it 1 or 2 more times. But if it's still tender after that, give it a break for a good hour or 2, and then try again. But if you're still sore after like a day or 2 of trying this technique, please make an appointment with your medical doctor or your OBGYN because it could be a sign of a more serious condition. So that's my tip on breast tenderness. I hope this has been helpful. If you have any questions, feel free to post in the comments below. If you like our content, let us know by clicking the like button, and please subscribe. Until next time, stay well.